In this procedure, you'll learn to perform and interpret a Quickvue Plus test for infectious mononucleosis. Outdated or cold agents don't react as expected. If the test kit has been refrigerated, remove it and allow the reagents to warm to room temperature. Be sure to check the kit's expiration date. Then put on a fluid-impermeable lab coat, sanitize your hands, and put on a pair of gloves. Before testing the first patient from a new test kit, both controls must be checked. Run the positive and negative liquid controls provided in the kit to ensure they react as expected. If they show the appropriate results, the test kit can be considered reliable. Record your control results in the log. Greet the patient and verify her identity using 2 identifiers.
I'm Dana. Can I have your full name and date of birth?
Laurel Shea.
Explain the procedure to the patient to help gain the patient's cooperation and address any questions and concerns.
So what we're going to do is we're going to do a simple blood test using a couple drops of blood from your finger, and it'll tell us in just a couple minutes.
Observe standard precautions by putting on gloves, remove the test device from its protective pouch, and label it with the patient's ID number and the date. Disinfect the puncture site with an alcohol swab. Allow it to dry. Then, perform a capillary puncture. Wipe away the first drop of blood. Then fill the disposable pipette with capillary blood up to the calibration mark. For accurate testing, the plastic capillary tube measures the exact amount of blood needed for the sample. Once you've filled the disposable pipette, dispense the blood from the capillary tube into the well of the testing device. Now you're ready to test the sample. Hold the developer bottle above the well and allow 5 drops of the solution to fall freely. Be careful not to touch the dropper to the card. If it touches anything, the dropper becomes contaminated and the results of the test will be inaccurate. You can read the results in 5 minutes. Read the test result when any blue color appears in the test complete window. If no blue color appears within 10 minutes, the test must be considered invalid. Do not read the test after 10 minutes. In a positive result, a vertical line in any shade of blue forms a plus sign in the read result window, along with a blue test complete line. Even a faint blue vertical line should be considered a positive result. If the result is negative, no vertical blue line appears, leaving a minus sign in the read result window, along with a blue test complete line. If no line is seen in the test complete window, or a blue color fills the read result window, the test is invalid and must be repeated with a new testing device. Once the test is complete, dispose properly of biohazardous waste material and disinfect your workspace. To ensure infection control, remove your gloves and lab coat, then sanitize your hands. Document the control results in the lab log if you haven't done so already. Always document the test results in the patient's health record.